We are at Family Care Health Centers at the Forest Park Southeast location in St. Louis, Missouri. I have practiced primary care in this center for 21 years. I have been really, really grateful to practice in this setting.
We're at Ferguson off of Pershaw Road. Phinia Healthcare is a federally qualified health center that provides a wide variety of services to our community. I want to be that someone making a difference.
I grew up about 15-20 minutes from this clinic. SEMO Health Network in Bernie, Missouri. There's not even a stoplight in town. It is close and dear to me because I was the family member that the family couldn't get to an appointment. I had every vaccine twice because I didn't have a vaccination record. When I tell people about vaccines, it's not because I'm not getting them. Everybody I know gets them, and I highly recommend them because it protects everybody.
Vaccines are an integral part of preventive care, primary care, holistic care. It is one piece of what we do in primary care to promote someone's health and to troubleshoot problems that they're having.
We talk about vaccines starting from that first visit. I try to see where they're at and why they're opposed first. I leave it as, I understand your concerns. I do always say I am pro-vaccine. I support every vaccine that is recommended by the vaccine board and on time schedules, but I will work with you. I will respect your decision, but I will always ask you about where you at with this decision. The first and foremost thing is that I like to approach everyone with the understanding that we all want to do what's best for the children.
I think it's important for us to acknowledge how our culture is changing. Never before the pandemic did I ever experience a patient having an emotional response to me asking if they would like a vaccine. It's triggering, so being attuned to our patients is really key. Sometimes when a patient declines a vaccine now, they'll sometimes take it in the future. Another recommendation is to try to have those vaccines in the clinic immediately available whenever possible.
I think parents do feel overwhelmed with the actual injections. It's nice if facilities can stock the combination vaccines when you can reduce those number of shots, but also just letting parents know, like, hey, their body can handle it, and it's better to do multiple shots at once instead of bringing them back repeatedly and each encounter them needing to go through that trauma of getting shots. I let them know that we have studied extensively the number of antigens that are present in the vaccine that kids are exposed to, and let them know that it is safe and effective. Since babies are born, they're exposed to hundreds of thousands of antigens. What we're putting in their system is like a drop in a pool based to what they're seeing on an everyday basis. So their immune system, if they are not immune compromised, can handle it. So I try to help parents to understand that part of the thought process of why I recommend that you get them all that day.
There is no public transportation in Southeast Missouri. A lot of families don't have vehicles. The inconvenience is very hard on patients and families because they just can't get to the places they need to go. When they come in for a sick visit, you have to try to get that child back for a vaccine or even an adult back for a vaccine, and that's not their priority. Their priority is they're coming in because they're sick, and the vaccine is the least of their concern. So what we try to do is do as much as we can at one visit, which a patient's in a 15-minute spot, the kid doesn't have a fever and they're healthy enough to take a vaccine, the mom's okay with it, give the vaccine because it may be the only time you see that kid that year.
I would just recommend not to take an all or nothing approach. I would suggest educating yourself beyond what is provided in the medical education system. Become familiar with the trends because they do affect your everyday practice, how people on the internet are kind of providing the information so that you can knowledgeably and accurately kind of dispel some of the myths that are going around.
The more that we can recognize trusted messengers, collaborate with them, leverage them, the better. Very often a patient will tell something to someone on my team that they don't feel comfortable sharing with me, or they may take a recommendation from someone on my team more than me, and I honor that. Every member of our team has a level of expertise that is equal to mine. It's just that we all have different forms of expertise. Being a primary care doctor is very similar to being a mother. You can't control the other person, but you can guide, you can educate, but most importantly, if you respect and empower, then that individual may make choices for themselves in the right direction.
Now, as a primary that works close to the community, I'm helping these people that helped raise me. And I've watched them grow and I've watched them pass. And they helped raise me through life to make me the person I am, and now I'm able to help them. And as providers, that's all we want, is to help people and educate.